it's Dr. Jill Olthoff with Olthoff Wellness Clinic, and I am sitting here with Shannon. Shannon, tell me a little bit, we started 6 months ago with your neuropathy. Tell me a little bit about what you were experiencing, why you had this, what was going on.
Well, I had the crazy neuropathy because 6 years ago I finished my chemotherapy from breast cancer, and my feet were numb, and I couldn't, they were always cold, and they always hurt. So it was hard to walk, it was hard to do my daily life. It was just hard to do anything. And so I saw this little ad on Instagram and I thought, oh, I'm gonna call that number. Maybe something can help us. I looked everywhere, I couldn't figure out anything else to help it. And I was trying some different things and nothing was working. So I came in and I did a bunch of little crazy tests and I saw what my numbers were and I saw that I had a lot of loss, nerve loss in my feet.
Yeah. What has changed? Because it's been 6 months, so we've
6
had
months.
some time for some healing.
Yes.
What's changed?
A lot has changed because of the treatments that I've been doing and making sure that I'm taking care of my feet. I can now walk without so much pain.
Awesome.
I don't have as much numbness. The numbness is what I really had because of that darn chemotherapy. I had a hard time with, I just couldn't feel my feet very well. And so I didn't know if I was stepping on something. It just felt like I was walking on rocks all the time. Now I can actually, the other day I was just thinking, wow, I can actually feel the fibers of the carpet on my feet because I'm walking across the carpet. I can actually feel the carpet fibers, which before I couldn't feel it at all.
Awesome.
I couldn't tell the difference at all.
Has it changed anything as far as it's changed your walking, obviously?
Yes.
Making you more active?
Yes.
What about sleep? Affecting sleep?
Oh, I sleep a lot better, and I didn't really think about that. I have been sleeping a lot better because I don't wake up in the middle of the night and it doesn't throb and hurt so much. I don't have to take any Advil anymore. I used to take Advil at night because it would just, sometimes it just hurt so much. And it would wake me up in the middle of the night. So I'm actually sleeping through the night.
Awesome.
I'm not having any of those issues anymore, and it's just so much better.
I'm so thankful for that. Well, I really appreciate you telling your story because I know that there's somebody else out there that might be dealing with something very similar to this and wondering, gosh, is there any other answer besides taking, you know, the gabapentin or the...
I just did not want to take any drugs because I'm like, that doesn't do anything. They said that everything I read, it said it just masks the symptoms.
Well, that is a true statement because it doesn't heal your nerves.
Heal the nerves.
Yeah. Well, I am so grateful that you went through it and that you took the step and the courage to do so.
Yes.
And I'm excited about your changes.
It's so worth it. And I would encourage anybody to do it. And it's I never would have noticed it. I just happened upon it. Yeah. And I thought, this is fantastic.
Yeah, I love it. Thank you so much again for sharing your story. I know that sometimes it's a little bit hard to share that and to talk about how much it's impacting your life, but I know that somebody out there might really get use out of this and be like, wow, I don't even know, maybe they could help me.
Perfect.
So if you're asking questions like that, like, is this a neuropathy that you can treat? Certainly give our office a call. The only way that we're really going to know if we can help you is to do an exam that's catered towards you and your problems. And then we can really talk about whether we can or cannot help. So give our office a call at 970-686-6833.